Fucaroin if you give, the small stones may come into the CBD. There will be obstruction of the common bile duct. The patient may develop obstructive jaundice. So in such kind, if when it is a multiple stones, small stones are there. If a very severe pain is there, spasm of the smooth muscles are there, utilize Narikela Lavana and Bhaskar Lavana Churna or Vaishwanara Churna. Naturally his pain will come down. If it is Pitta Pradhana, it's a Pitta Sthana, Vata pain will be there. Just to utilize, if it is Pitta Pradhana, utilize Sutta Shekhar Rasa, Kama Pradhana, utilize Arogyavarti. This is the difference. One is Vata Kapha and one is Vata Pitta. Just to utilize, and Kamadud Mukta, if it is a more Pitta is there, Kamadud Mukta, Mukta Basma. Utilization, naturally the pain will come down. You can utilize Patoladi Gana, Patoladi Katpurohinya, Kashayas, or these drugs can be utilized. When there is a cholelithiasis, cholecystitis, CBD stone or obstruction is there. Definitely first line of treatment always for the obstruction is the surgical intervention. As a medicinal treatment, these things can be done. I am not discussing about Kamala, all these things. Anyhow, in infective conditions like Kamala may be there, viral infections, viral hepatitis may be there, or bacterial infection, cholecystitis may be there. That condition, if it is a bacteria, you need modern antibiotics because it's an acute state. But after acute state of infection goes, better to go for a surgery because there will be recurrence of infection, there is chances of Pyosil, Abhyantara Vidrat, and perforation. This is all complicated. Patient goes into peritonitis, that is Abhyantara Visarpa. These are fatal conditions. Patient may end up with death. Better to go for surgical intervention at first place itself to save his life. But it is in a chronic state. Slowly, some diseases are there. Definitely, we can utilize Ayurveda treatment as a Shamana Aushadhi. I think if it is Shula presentation, go for Narikelavana. If it is a Daha presentation, go for Sutashekara and Kamdurmukta and Vaishwanara Churna, Arogyavartini. These drugs should be utilized. If it's a degeneration, like cirrhosis of liver, degeneration, if Avarana is there, you see, this degeneration is Dhatuksha Avastha comes due to Avarana. That is Charna. Vayo Dhatuksha Kova Margasya Avarana. First Avarana will be Avarana, there will be Dhatuksha. Patient may come with any state. They may come with 90% or 10% Dhatuksha, 50% or 50% Dhatuksha, 10% or 90% Dhatuksha. That is according to Avastha you can find out. So slight Avarana is there. First you go for Sadhyomana Hadevechana, Shodhana Chikitsa, that is at least post Shodhana Chikitsa, then give Rasayana exposure. Already complete Dhatuksha degeneration occurs, there is no chances of recovery. But slight Avarana that can be removed immediately, patient recovers from the condition. The Shamana Aushadhi you give with Gomutra Haritaki is the drug of choice in these conditions, specifically in cirrhosis of liver. Gomutra Haritaki. Haritaki with the Gomutra, if utilized, most of the patient will recover very nicely. But especially maybe alcoholic or other types of cirrhosis, Gomutra Haritaki is the drug of choice. You can utilize other drugs also, or according to, as a Vyadhi Viruddha I am saying, as a Dosha Viruddha, other drugs should be utilized. By that you are giving Dosha Vyadhi Viparita Chikitsa. Then coming to next condition, small intestine, all ajirnas, Agnimandya and Ajirana, they comes with this condition. Ajirnahara, patient presents with Shula and presents with Udavarta, presents with Lavitta. All these they present with all these conditions. They come to us. If it is surgical condition like Bandha Udodara and perforation, that may be there. Infection may occur with appendicitis or other infection into the intestine. There may be growth. Gulma may be there. So the Sannipataja Gulma nothing but a malignant condition. Ekadoshaja Gulma is the single growth may be there or just growth like a situation may happen. And Baddha Gudodara may happen. These are the surgical conditions. What we can have a OPD level treatment. First in OPD level treatment is you should able to find out is it a surgical condition or is it a medicinally treatable? Once you think it is a medicinally treatable, then you should think according to Ayurveda. A Shula Pradhana will be always Vata dosha will be there. Is it Ekadeshaja, maybe Raktavarana Vata will be there, maybe due to infection or maybe allergic or maybe a ajirna. All this can have patient presents with Shula. If it is ajirna, give Hingvastaka Churna and Agnigun. It's a drug of choice. Definitely you can get a very good result in this drug. And Narikela Lorna. If it is Pitta Pradhana, utilize Sutta Shekhar Prasad. That's what I am saying. Other Saushadis, utilize it in your practice. Definitely, in most of the cases, will get an excellent result. The Arista is Jirakadya Arista. In such kind of Jirakadya Arista is the drug of choice, or Takra Arista also you can utilize. But I am using Jirakadya Arista. I think most of the cases I get excellent result with the Jirakadya Arista. Bhaskara Lorna Churna is there. That also can be utilized. And degeneration, of course, due to Avarana, there may be degeneration. Again, patient presents with some obstruction, all these conditions. Surgically, it should be excised. There is no other way. Coming to large intestine, patient comes with Atisara and Pravahika. And also flatulent abdomen or Shula, Udavarta, Arti, all these presentations may be there. It may be Baddha Gudodara, it may be Parisravyudara, or it may be infection, maybe appendicitis or other infection conditions. It's all our presentations. First, you should, in a clinic, when you sit in the clinic, they come with Shula or Udavarta or Gulma. You should find out whether it is treatable with the medicine or surgery. Definitely, you should take a clinical examination to do, then go for sonography or X-ray. These things you find out what is it. If it is surgically, definitely go for Shastrakarma. If it is a medicinally treatable in a OPD level, the drug of choice will be, if it is Atisara, again you should see according to dosha. There will be loose motion. You see, in Atisara you see, it's a Pitta Pradhana Vedi. Pittasya Apya Mahabhuta increases, you get Atisara. Agneya Mahabhuta increases, you get Jwara. When Apya Mahabhuta increases, you get Agnimadhya and Atisara will be there. The drug, it's only Pittaja, there will be severe Atisara will be there. But it's a Vataja, there will increase frequency, but hard stool will be there. But it's a Kafaja, the Atisarana of the Mala with the mucus will be there. Again, it is a Ama or Nirama. You should diagnose it, and a specific drug should be utilized. The drug of choice, if you say Kevala with a severe Atisara, may be due to infection, like amoebic dysentery or bacterial dysentery, gastroenteritis. It's all acute state. Definitely, you may use IV fluid and Amastambhana Dravyas can be used, and modern antibiotics should be utilized. If it is in a chronic state or repeated, definitely it is a field for Ayurveda. They come to us with these signs and symptoms. What I utilize is the drug of choice is Kutaja Ghanavati. Kutaja Ghanavati. That is the best drug. And Agnitundi. And Kutaja Barpati. Dadimastaka Churna. So in the large intestine, then small intestine, I come to Dadimastaka Churna. When upper GI, I utilize Vaishwanara Churna. Lower GI, I utilize Dadimastaka Churna. And Sutta Shekhara is in upper GI, but lower GI, go for Agnitundi. So differentiation will be there. Because Ajirana is more happening in the lower GIT, in upper GIT Agnimankya. So definitely the upper GIT usually Pitta is more involved, lower GIT more Vata involved. So Agni-Thundi utilized. In the upper GIT Sutashekara and Kamadod Mutta is utilized. In lower GIT specifically more of Vata involved. It's a Vata sthana actually, what Charaka says. So Agni-Thundi and Dadimastaka, Hingvastaka, Bhaskar Lavana, these are the drugs. Kutajarishta, Mustakarishta, these are all drugs utilized. There are many other drugs are there. Kapita, Ashtaka Churna is there. Yeah, what I say, Dadimastaka Churna is there. Or just take Dadima, whole Dadima, make a juice with takra and give to the patient. You get excellent result. These are all, I can say excellent result, but in a presenting patient, you should diagnose which dosha involved and for a Vyadhi, I can say which dosha involved like that, should take anupanas and according to should be utilized. In the Rasavashadi, drug of choice for this large intestine disease is Varpati Kalpas, Rasavarpati or Panchamrita Varpati or Kutaja Varpati. Can be given as a rasayana dose in increasing phase and decreasing, like that also you can utilize, or otherwise also you can utilize. The other diseases we get in large intestine, ulcerative colitis and Crohn's disease. I think in the modern system of medicine there is no answer for this. If it's an infection, modern system has answer, that is antibiotic. If antibiotic is not there, there is no answer in modern system of medicine for these diseases. It is for Ayurveda. In Ayurveda, it's autoimmune disorders. Definitely, drug of choice, what I say is Yashtimadu and Musta. It's a kashaya should be given without adding milk. He should avoid moong dal, all these things, spinac, these things which have more fibers. These things should not be given such conditions. And Shankhavati, these drugs if you utilize, most of the cases of Crohn's and ulcerative colitis can be cured. As a Shodhana, you give post Shuddhi by Sadhyomana and Sadhyavirechana, give as a Rasayana, Yashtimadu, Kashaya, utilize it. Definitely these are the diseases can be cured. I think I have covered almost all the diseases of gastrointestinal tract from Mukha Roga. Another is that Chardi, I think I have not told. The Chardi is a really tricky situation. When a patient comes with the acute state of Chardi, I think we have to utilize modern medicine because whatever drug I give, it's all omitted. Patient can't respond at all. But anyhow, if it's more of Kaphaja Chardi, utilize Ardraka Swaras. And more of Vataja Chardi, more sound and only omitting, then utilize Mayura Pichabhasma. It has excellent action, Mayura Pichabhasma. Another disease I think I have not narrated here, that is Hikka. In Hikka and Chardi, Mayura Pichabhasma is the wonderful drug. Usually Hikka occurs due to irritation to the diaphragm. Diaphragm is irritated due to gastritis. Patient gets Hikka. Maybe by central nervous system irritation, by a patient of stroke or CVA, in the end stage, they will have severe Hikka. Even by MI or pneumonitis or gastritis, whenever there is irritation of diaphragm, patient will have Hikka. That is Samuthana Vishesha. Even the modern way of understanding of Samuthana Vishesha, if you understand what is, how it occurs, then specific treatment can be given. If it is a MI is the cause, go for MI Chikitsa. If it is pneumonitis, go for Vasa Chikitsa. Infection is there. If it is a gastritis, no infection, only gastritis, acidity is there. You Amla Pitta Chikitsa. For Chardi also, these are all causes. Pneumonitis, your cardiac condition, or gastritis, or intestine conditions, all these things, or a Shula, Udavarta, in Vyanavartapana, you will have Gulma, Arti, Parikartika, Chardi is the one of the Vami, Atmana, Udavarta. These all symptoms will be there, classical sign symptoms. Vami, Atmana, Udavarta, Gulma. These things occurs in a GI tract because All Anuloman occurs due to Apana Vayu, whereas Prasarana Akunchana occurs due to Vyana Vayu. When Vyana Vayu becomes powerful, Vyana Vrta Apana, you will have Vami, Atmana, Udavarta, Gulma, Arti, Parikartika. All these signs and symptoms will be there. For the Chikitsa, he says Tikta Anulomana should be given. But if it is only Kevalavata, if Kapha and Pitta Samsarga is there, then Kaphahara or Pittahara, Vata Anulomana, Chikitsa should be done. So, I think when severe Chatti is there, you may need Ayurveda and anti-emetic drugs, modern antibiotics, because it can be by injection you can give. One dose may be sufficient. Once you start to give your medicines inside, then your medicine start to work. No need of this modern anti-Chatti medicines. But if patients are able to take your drug, then Chatti may reduce. But in all the cases, I don't say we can get a successful result. But in Mayura Vichapatma and Ardraka Swarata, you can have a very good result. And another, if it's a Kevalavataja, a psychological origin, I think this Madi Pala Patra Kashaya. This is a wonderful drug. You can utilize it for treatment. Or Mrittika Kashaya. That also works wonderfully. By smell of the Mrittika, mud, patient gets relief from vomiting. Recently, I had one patient have so much powerful vomiting, but only sound. There is no material coming. That's a Kevalavata Chardi. Patient was treated with all modern anti-emetic drugs. She didn't get any result. Then what we did, we gave old pots piece made into kashaya and gave. Patient gets immediately from vomiting. This is a wonderful treatment. So sometimes it gives excellent result. Usually in the Buddha Vaidyas in villages they give this treatment. For I think all other conditions I have told you. So if you have any questions, I think one is Grahani is there. The Grahani I will tell you. In a modern perspective, as a anatomical aspect, we can't explain Grahani, but from a physiological aspect, from working pattern of the intestine, you can say Grahani. Uh, you see, Grahani is a Vata Pradhana Vyadhi. What is the signs and symptoms of Grahani is Muhurbhadda and Muhurdrava. It is usually people think that it's a Kavaigunya dosha is the Pitta. Actually, Kavaigunya dosha in Grahani is Vata dosha. Why it is so? In Atisara it is a Pitta, but in Grahani, Kavaigunya dosha is Vata. That is the difference between Grahani and Atisara. In Grahani, there will be Muhurbhadda and Muhurdrava is Atma Lakshana. Why this Muhurbhadda and Muhurdrava occurs? If you take rice to boil, it takes about 10 minutes. Agni is there. You put rice with water on the over in a pot over the Agni. If you keep 10 minutes, it nicely it become a paka. If you keep it only 5 minutes, it will be drava. If you keep it more than 15 minutes, it will become dry. So, how much time you keep on the fire decides is it Muhurbhadda or Muhurdrava. So, time is managed by Vata dosha. So, that is why Kavaigunya dosha in Grahani is Vata dosha. So, that is why Charaka usually says to give Grutas, specifically Changeria Gruta or Shatpala Gruta. It's a wonderful drug for Grahani. Many of the patients comes with the Grahani. I think usually we diagnose ulcerative colitis as Grahani. Ulcerative colitis is not Grahani. Ulcerative colitis is a case of Raktatisara or Crohn's disease Raktatisara. In the Grahani, in the ulcerative colitis, there will be continuous loose stool with blood and mucus. Whereas in the Grahani, Muhurbhaddas, sometimes loose motion will be there. And such presentation is there. Usually it occurs due to Agni Madhya variation of Agni and variation of the Samana Vayu, it occurs. So, give Gritas, specifically Shatpala Grita and Changerya Grata, it works wonderful in such conditions. So if you utilize, you can cure the Grahani. So and Ingvashtaka Churna or Bhaskar Ravana Churna, these steps can be utilized in your treatment according to presentation. Say Kevalavata may be there, Pitta Samsarga may be there, Kapha Samsarga may be there, according to involvement of dosha. Utilize a specific drug and give treatment. But the Dhruta is the drug of choice in such conditions. It's in OPD level. These are all many drugs I have told you. Many of the things I have told, many of the I may not tell everything because according to presentation, you see, you have to utilize these drugs. And Sadyomana Hadya Virechana in all these conditions is excellent Shodhana Chikisa. No need of classical Amana Virechana. Just you use Sadyomana Hadya Virechana, get Kosh Shuddhi, so that there will be Agni Deepti, then you can utilize this Dravyas and Rasayana drugs. Utilize, definitely you can get a wonderful result. So with this, I conclude my presentation. Hetu Linga Vishadam Jnanam, Swasthatra Prayana. Patient comes with the Linga. You have to see what is Hetu. That you have to give Aushadam. That is why Vakvata says, Dushyam Desham Palam Kala Madalam Praktam Vaya Sattvam Satyam Aharam Avasthasya Sukshme Sukshma Pariksha. Dosha Nirupana first. Dosha Ausha Nirupana. After doing Dosha Nirupana, give the Aushada Nirupana. It is a physician's domain. Swayam Diya Uhya. With your own intelligence, you do Uhana. By analyzing signs and symptoms, you see which dosha involved and where is this, what is Samuthana Vishesh, how this Samuthana occurs, and what is this Anasamshaya. Patient may comes with the same symptoms. So, Amla Pitta symptom may be there, but Anasamshaya may be large intestine, small intestine, or a gallbladder, or maybe pancreatitis, or maybe Amla Pitta, or a hiatus hernia. All these presents with all these Samuthana Vishesh. So that and Sthana Samshaya, these two things you should understand. That is, Trivida Bhoda should be there before giving a treatment, even in OPD level practice or in IPD level practice. Don't think IPD level, OPD level different. Everywhere you have to find out these Trivida Bhoda should be there. After that, you should give specific treatment. So that is why there is no Roga without dosha. After analyzing dosha, Anuktamapi or Uktamapi, see dosha linga in a given vyadhi, give specific treatment. In a conclusion of what I am saying, if students are there, Satata Adhyana you do, and Vada, that's a discussion. So this transfer of knowledge will be vertical and horizontal. Vertical by Adhyana, Vada there will be horizontal, Paratantravalakan horizontal, whereas Sadvidyachara Seva, both vertical and horizontal transfer will be there. So daily you are having discussion, horizontal transfer, and also there will be vertical transfer of the knowledge. With this understanding, I have concluded my presentation.